on employer best practices. This is Melissa Cleater, CareerSTAT Manager here at the National Fund. Next slide, please. We're going to go ahead and get started. We only have 30 minutes, so I want us to really make the most of our time here. Today, we will hear from Jessica Jacob on how Tufts Medical Center leverages its participation in an industry partnership to build and strengthen community-based partnerships. We will start with a brief overview of CareerSTAT just to give some context for folks who might be new, and we'll hear a little bit of an overview of Tufts frontline worker investments and their partnerships. And then it will be followed by an interview with Jessica to get a little bit more details. And since we are trying this 30-minute format, I really do encourage everyone to chat their questions throughout the webinar so we can field those as we go along. So for those of you who may be less familiar with CareerSTAT, it is an initiative of the National Fund for Workforce Solutions and is an employer-driven network based on peer exchange. The National CareerSTAT Network has members in 45 states and includes a range of healthcare employers based in a continuum of care. It also has industry partnerships, workforce development partners, and philanthropic organizations. And CareerSTAT is free to join and open to all who have interest in healthcare workforce development. The Frontline Healthcare Worker Champion Program is a cornerstone of CareerSTAT and was created in 2014 by a group of healthcare industry leaders who were very interested in recognizing and encouraging their peers who were making sustained investments in the skills and careers of their frontline workers. A peer committee sets the criteria and determines the recognition status. And so far, CareerSTAT has recognized over 50 healthcare organizations, which includes our 2019 determinations. A public announcement of the newly recognized organizations is a few weeks away in June, so please stay tuned for that. That is coming soon. And the reason I talk about the champions is to provide context for the best practices. So champion organizations were heavily involved in creating the CareerSTAT Guide for Investing in Frontline Healthcare Workers, which offers healthcare organizations evidence-based best practices for implementing workforce investments and integrating them with business goals. And this entire webinar series is an opportunity to learn more about the best practices that champion and emerging champion organizations use to invest in their frontline. So now I'm going to turn it over to Jessica, who's going to share a little bit more about Tufts Medical Center, who is recognized as an emerging champion.
Great. Good afternoon. Thank you. So I'll start off. As Melissa said, I manage workforce development here at Tufts Medical Center. And if you'll go to the next slide, I'll just give you a quick overview of who we are. So we're a 415-bed academic medical center. We're the primary teaching hospital for Tufts University School of Medicine. And we have a full-service on-site pediatric hospital, the floating hospital for children. We're located in the heart of downtown Boston, in the Chinatown neighborhood, which I'll talk a little bit more about how that location impacts our partnerships in a minute. And just to give you an idea of our size, we're about 5,800 employees, and 30% of those would be classified as frontline workers. So some background about our workforce development at Tufts Medical Center. So on and off since about 2006, we had a number of workforce development partnerships and programs, training, grants, but nothing that was really done with some strategy behind it and institutionalized to become a part of our overall organization and strategy. So what happened around 2014, 2015 is these programs started to wane, and some of the partnerships were kind of left by the wayside because there was no one to manage them. They hadn't been tracking outcomes, so there was not really any way to leverage or make a case for maintaining these programs. So we had some new human resource leadership in 2016. We brought in a new VP of HR who had a real vision for workforce development and incorporating that as a strategy for for people here at Tufts. And my role became a full-time position in 2017. I was brought on at the end of 2017. And through getting involved with CareerSTAT and participating in the Employer Academy in 2017, 2018, we were able to develop and begin to implement a multi-year strategic plan for workforce development. So if you go to the next slide, actually skip ahead 2 slides, one more. Thanks. So going back to the programs that didn't take off and the partnerships that kind of waned, and why workforce development wasn't successful before, we kind of implemented this new plan with some different strategy behind it. And one of the main things I want to highlight is that from the get-go, we were collaborating and aligning with some key organizational goals, just the broader picture of who we are as an organization. And so 3 areas that we really looked at are aligning workforce development with talent acquisition, with community health improvement programming, and with organizational development and learning. And so looking at how we can build up and leverage our community partnerships in light of supporting the goals of those 3 areas of the organization. So looking at local inclusive hiring, working with talent acquisition to meet our current hiring needs, planning ahead for future workforce needs, working with community health to look at how we as a community-based employer can be supporting the goals that they have in our 4 target communities, which are, for Tufts, are the 4 neighborhoods that are surrounding where we are as a hospital. And lastly, working with organizational development to make sure that there's an infrastructure to support the programming and the resources and the model that we're implementing, so that leaders are engaged across the organization, managers and supervisors are trained and equipped to support frontline development. And that is all internally a larger infrastructure and not just a siloed piece of human resources. So with that, you can go back 1 slide and I'll just share some highlights. We're currently in the 2nd phase of the multi-year plan that I mentioned, which is about a 6-year plan. It goes through at the end of 2021. It started in 2017. And I don't have time to go into all of these areas, but happy to chat offline if anyone wants to learn a little bit more, share my contact information. But what I really want to talk about today is this idea of building and formalizing community partnerships, which is the foundation for everything else that we're doing, and is integrated into every other piece of workforce development throughout the 6-year plan and on. So if you'll go ahead to the next slide, 2 more slides up. Sorry, I got these out of order. I'll talk a little bit about the Boston Healthcare Careers Consortium, which is the industry partnership that Melissa referred to. So the Boston Healthcare Careers Consortium has been active since 2010. It is through the Boston Private Industry Council, which is our regional workforce investment board. And the PIC, as we call it, serves as the kind of connector and convener for the Healthcare Careers Consortium. The consortium is employer-led. It is currently co-chaired by 2 workforce development leaders from hospitals here in Boston. And then there's a full-time staff at the PIC who is designated to kind of coordinating and organizing and supporting the consortium. So we're currently about 50 active members strong, 18 employers, 35 education and workforce system organizations. So that includes the community colleges, includes technical vocational schools, the city's career centers, and a number of other nonprofit and workforce training programs. We convene quarterly. There's a wide variety of topics and formats for these meetings. We will do everything from spotlighting current member organizations, discussing challenges that kind of shared pain points that we're all seeing, highlighting resources, highlighting opportunities for people to connect and to engage in solving problems. And we've done a number of research-based projects. Just overall sharing of best practices. So that's kind of everything I have in a nutshell. If you want to move on.
Yeah, no, great. Thank you so much for that overview. I think it really provides some good context for the next part of this, which is the interview portion. And again, I encourage you, if you have any questions, please to use the chat function, and I will coordinate those questions. But I will get started by saying, leveraging partnerships is a best practice that's highlighted in the guide, and it's talked about a lot, but I feel like it is something that is easier said than done a lot of times, that it takes a lot of time and effort to engage and maintain those relationships. And you talked a little bit about historically how Tufts had some community partner relationships, but it's had been a little up and down with maintaining those, and that you have these re-energized efforts to get engaged and get a little bit more formalized. So can you tell me a little bit more about how the consortium helped with that? What kind of role did the consortium play in building and maintaining some of those relationships?
Yeah, absolutely. So like I said, when I stepped into this role in 2017, getting involved with the consortium was step one, and Tufts Medical Center and people from HR and workforce development at Tufts had been involved since the beginning. But for me, coming into this role and looking at how we're going to revitalize and re-energize some of the programming and the partnerships here, I was able to connect with the other employers and get a really quick and thorough overview of the landscape of what's going on in workforce development here in Boston. And they were very, very generous with their time to share what they had seen, and some advice and some growing pains that they had gone through that I could avoid, and various other things. And then meeting community partners that were involved in the consortium, learning about the different resources and expertise that they each brought to the table, and being able to kind of see a broader landscape and assess because not everybody is meant to work with everybody. There are partnerships that are a better fit for where we are at different stages, and for who we are as an organization, where we're located, the communities we're working with. So that was really helpful to be able to meet and understand what everyone is doing and where their areas of expertise are, to then assess, well, what is a good fit? What are we, who's a good fit for us to partner with, and what makes sense for where we are right now.
Yeah, absolutely. So that sounds like the consortium gave you an opportunity to meet partners in a relatively low stakes way, to learn a little bit more about their services, and essentially mutually vet each other to establish, that the ability to determine who is a good fit for what your goals are and what their goals are, and to get to know each other a little bit more, to establish that initial relationship that's so important to building a partnership.
Yeah, absolutely.
Great. So when it comes to the consortium, is there anything, you guys are lucky to have a particularly long-standing and strong consortium and industry partnership in the Boston area. Is there anything in particular that you feel that the consortium does that is really helpful in building these relationships?
Yeah, good question. I think, excuse me. Just the model and the way that they organize and collect input from all the participants is a huge piece. So would strongly recommend to anyone that's looking to build or strengthen their current industry partnership to talk to the leadership here in Boston, because they've done a really good job of organizing it and structuring it in a way that allows different people to have a voice and different topics to be covered. And sorry, I hope that answers the question, but yeah.
Yeah, no, absolutely. And how far in advance are you usually getting that agenda? How are you ensuring that you are sending the right people to these meetings?
Yeah, that's another piece. They they tend to try and send out the agenda as a few weeks in advance, so that there are people from my organization or from my community partners that I work with who I feel should be at the table or who would, really benefit from being at a particular meeting, we can do that. As much as we're able to. They plan ahead.
Okay, great. And so you mentioned, about how some of these, you were looking at the partnerships to determine how they might help you meet some of those organizational goals that you have within different departments at Tufts. Can you talk a little bit about what those goals are and how those partnerships help you reach those goals?
Yeah. So I mentioned that one of the main goals that we have, looking at being a community-based employer and looking at local inclusive hiring, is to target these 4 surrounding communities that are our primary communities that we're looking at, neighborhoods, I should say, in Boston. And leveraging community partnerships has been huge in building towards that and doing that better. We're not there yet. We're very much at the beginning of doing that better, but looking at community partners who are integrated into the community, who know the people who live here, who have an understanding and an expertise that we may not have, and can help us do that well, that can provide their knowledge and their know-how of, who are the people in this neighborhood and in this target community, and how can we connect with them as an employer, how can we train, how can we provide the resources that they need to be successful in employment and in education and training initiatives. So we've really leveraged that. And for us, our closest community partners are all within about a mile of.
You might stop by so she can see it.
Can everybody on the line please make sure that they're muted if you're not muted?
So that's one piece, is just leveraging the community know-how and expertise that they bring to the table. And then, sorry, what was the second part of the question? I will.
Yes. No, I think you touched on it. I mean, you touched a little bit on the goals and how they help you meet those goals. And I think particularly, the idea of being trusted in the community and helping to be able to meet some of the goals that you all have around diversity and inclusion, and having a staff that's a little bit more reflective of
right. And I can give you an example too, just so where we are here in Chinatown, the current demographics in the population in the neighborhood immediately surrounding the hospital, it's 49% Asian. It's 51% are coming from households where English is not the first language or the primary language, and 49% are non-native born or foreign born individuals. So looking at those demographics and then looking at so we want to hire from this community. We want to provide training and education opportunities that would lead to hiring from this community, and being able to work with some of the partners here in Chinatown that are able to bridge language gaps, to have cultural, help us with cultural competency and understanding any cultural barriers to hiring and employment, and to integrate those things. One of the community partners we work with, they have a program that works specifically with highly educated immigrants and people who are coming over with foreign degrees, which is really relevant to that community that we're in. And they have 10 levels of ESL all the way up to an advanced college level. So they're really looking at not just getting basic English skills, but how do we get people up to a point where they can be employed and employed well with their English levels. So just to give you a more concrete example of how we've leveraged a partnership, even right here in the primary community where we're located.
That's great. So again, you guys have this really strong partnership that is central to your work and central to the work that Tufts does. Do you have any advice for people who don't have the benefit of a strong industry partnership around building these types of partnerships within the community?
Yeah, I think for me, with the consortium, I was able to kind of have a fast track to building a lot of these relationships, and able to do it very quickly. So it might be a little bit slower, I guess, without that benefit of having that industry partnership. But I think really taking the time to meet and to vet and to determine, how are these going to be mutually beneficial relationships, when possible, meeting with other employers and learning, about successes and anything that they can provide advice-wise. But really, I think just getting out there and meeting and determining which are the strongest partnerships to pursue and which make sense and which are a good fit for both organizations. And we did a lot of that as well. Even with the consortium, I was still out meeting and determining who we would be working with and who we wouldn't be working with. And then formalizing partnerships too is another big piece I can recommend. Getting things in writing about what expectations are and what you as an employer will provide and what the community-based organization will provide.
Yeah, absolutely. And just to piggyback on that, it sounds like the relationship building is so key. And I think the part that often takes the longest to build in any partnership or relationship. And one thing that folks could do that don't have the benefit of that ready-made industry partnership, but also have to explore your other connectors, right? So who are people who work within your organization that might have connections to other organizations? Maybe it's board members, maybe it is your current staff that previously worked at another organization and has come over to you. It's those connectors, those warm handoffs can make such a huge difference in opening the door. So it is important to think strategically about what are the goals that you're trying to accomplish, who might be able to help you meet them, and then who might be able to connect you to those folks who are doing the work that could be helpful. So it looks like we have one question around the agreement, and folks I think are interested in this idea of formalizing the agreements, and would it be possible to have a redacted or a blank version of that? Is that something that you would be able and willing to share?
Yeah, absolutely.
Okay, great. And then this is someone else asked just quickly, could you remind us of the full name of the consortium?
The Boston Healthcare Consortium.
Yes. Okay, great. And so the other thing that you kind of alluded to is this idea of successful partnerships, right? Of being and having your expectations met. And in that range of figuring out, is this successful? How do you evaluate the partnerships that you're engaged in? What type of metrics do you use to determine whether this is working? Is this successful?
Yeah, so just jump ahead to the next slide. I think I have a couple more. So I'll just quickly, oh.
You want to go back?
I'll go back, yeah, because I will just share a little more detail about how, some of the ways that we're leveraging our community partnerships, just to give a little more concrete example. So such high level stuff that you don't get any meat. But one of the way, we look at externally, like in our community partnerships, they're across the, all of our community partners that we have written agreements with, I should state, help us both with external hiring initiatives, hiring and training initiatives, I should say, and then incumbent training as well. So that's something that we strategically looked for. So we'll do with our strongest partners, the ones that we have signed agreements with, we'll do block interviews. We'll block off time every time they have a graduation from their training program, specifically set aside for their candidates. We'll do on-site interviews with them at their location. We have a couple of different hire to train programs that we're involved with. And then internally, they're bringing their expertise and their training to our incumbent workforce. So a lot of times it actually links will hire from them, and then they'll come in and train people who we've hired from their organization who are now employees of ours. And then integrating that with the career pathway and the advancement training that we're looking at here. And have been able to really leverage the kind of wraparound support that they provide to employees as well. So that's kind of the unique thing about working with community-based organizations for our hiring purposes, is that they are able to do a lot more support that we wouldn't be able to provide as an employer. So if that's helpful, I thought I would just share that.
Yeah,
and then
absolutely.
advance to the next slide, I can talk a little bit about so some of the metrics that we're tracking and some of the ways that we're assessing or evaluating our partnerships from the get-go is, so we're looking concretely at the numbers of referrals from their organizations that we're hiring, and then more specifically from our 4 target communities. And if that number is not where we benchmarked it or wanted it to be, assessing, well, what's wrong, what information, what communication needs to happen to improve that. And we've already, even early on in our relationships, had to step back and say, okay, this isn't working the way we wanted it to, and how can we improve the communication and the process to get those numbers up. And then we're tracking retention. So we have baseline retention, looking at specific positions, if it's a training program that we're hiring from, or specific referral pipelines that we had set up with organizations. And then looking at advancement and career development here. So once candidates are hired, if they successfully are able to complete different on-site internal training programs, if they're applying and advancing with new skills and competencies. And so we'll survey managers, just kind of like pre and post surveys. And then overall advancement and wage gain is what we're looking for as well.
That's great. I think that's a great set of measurements to look at and to determine how successful a partnership is. So thank you so much, Jessica. I really appreciate you taking the time to share this with us all today, and putting together the slides and all this information. It's been really helpful. I do have just a few quick things in terms of some final closeout. If we could go to the next slide, please. So in terms of upcoming events for CareerSTAT, we have our final webinar in the series. It's scheduled for June 17th, and we're going to be looking at we're going to hear about how Mercy Health is partnering with 2 organizations, external organizations, to really take a team-based approach to their advancement and equity. And then there's the National Fund convening. The time is now. The registration deadline is May 24th. So if you have been thinking about registering for this convening, the time is literally now to do so. That's a few days away. Now, there is a rumor here at the National Fund office that the deadline may be extended until May 31st. But time and the slots are going very quickly. So if you would like to attend, I really do encourage you to register as soon as possible. And I did chat out a few links. So in the chat, you will see a link to register for the next webinar in June. And there is a link for the time is now. And then there is also an evaluation link. So we really like to hear your feedback. And if you could take a few minutes to just let us know what you thought about this webinar or any of the webinars that you may have participated in the series, we would really appreciate you to take a few minutes to do that. So I will give one final. If anybody has any additional questions or thoughts, now is your time. But otherwise, I really appreciate you all taking 30 minutes out of your day to learn a little bit more about the best practices that you could employ to advance in the skills and the careers of your frontline workers. Thank you all very much, and have a wonderful afternoon. Thanks, everyone.